Hello, everyone. Thank you so much for joining us today. I'm Dr. June Chin, Chief Medical Officer at Leafwell, and it's a pleasure to be here to talk to you about a topic that affects many of us, especially around the holiday season. The gut-brain connection plays a crucial role on how our bodies respond to stress, and the holidays can be particularly challenging. The hustle and the bustle of family gatherings and end-of-year pressures can all lead to increased levels of stress, which often shows up in our gut health. Now, many people experience symptoms such as bloating, indigestion, and even flare-ups of conditions like IBS or IBD, Inflammatory Bowel Disease, Irritable Bowel Syndrome. This can get flared up as holiday stress takes its toll. So in today's session, we're going to dive deep into understanding why stress seems to hit the stomach harder during the holiday season. We're going to explore the science behind the gut-brain connection and examine the impact of stress on gut health and uncover how the body's endocannabinoid system plays a key role in managing this response. Our goal today is to give you practical tools and knowledge to better manage holiday stress, to better support your gut health. So thank you so much for joining us, and let's get started. Understanding IBD versus IBS, Inflammatory Bowel Disease versus Irritable Bowel Syndrome. Now, these are digestive conditions, but they differ in causes, symptoms, and impact. So let's talk about IBD first. IBD is a chronic inflammatory condition from an overactive immune response. It can lead to abdominal pain, diarrhea, and potential complications like infections, bleeding, colorectal cancer risks, and it includes Crohn's disease. And with Crohn's disease, it can affect any part of the digestive tract with deep inflammation, causing abscesses, strictures, and even tears. So extremely painful. And then there's ulcerative colitis, and that's limited to the colon and the rectum with inflammation in the inner lining, leading to bleeding and infection. Let's talk about Irritable Bowel Syndrome. IBS is a functional disorder with no inflammation or tissue damage, causing abdominal cramps, bloating, and irregular bowel movements. Now, unlike IBD, IBS is not life-threatening and it doesn't increase cancer risks. Now, let's talk about the key differences. IBD is autoimmune and inflammatory. IBS is a functional issue. IBD can damage tissue, IBS does not. IBD is more severe with extraintestinal symptoms, and IBS affects only the digestive system. Let's talk about management. Management often requires medical treatment for IBD for inflammation, while for IBS, it's managed with diet, lifestyle changes, and you want to make sure that you consult your healthcare provider, and that is really essential for effective care. IBD affects around 2.5 to 3 million people in the US, with cases rising globally. Now, IBS treatments vary. It's usually based on symptoms and individual response. So here's a brief overview. You want to look at dietary changes. A low FODMAP diet. It reduces hard to digest carbs to lessen bloating. Look at your fiber intake. Soluble fiber can ease constipation, but may worsen during bloating. Do you want to avoid triggers? So looking at caffeine, alcohol, perhaps spicy, fatty foods. Those might be common triggers. There are medications that can be used, such as antispasmodics to relieve cramping and relax the intestinal muscles. Laxatives, stool softeners help with constipation. Then you have anti-diarrhea medication to control the loose stools and diarrhea. Antidepressants. Low doses may relieve pain and balance out bowel habits. There are newer medications that target specific IBS symptoms, like rifaximin for diarrhea. And there's also psychological therapies, CBT, managing stress-related symptoms, thinking about gut-directed hypnotherapy that can improve the gut-brain communication, mindfulness, reducing stress that aggravates IBS. And there's lifestyle modifications such as exercise to promote regularity and stress relief. And then another important point is sleep hygiene. Sleep hygiene supports gut health. It includes stress management if you're sleeping regularly. And then you can also think about things like journaling or breath work, and even counseling helps IBS. Some of my patients find it's very helpful to use probiotics and supplements. There are certain strains that help IBS. The brand that I like clinically is BSL3. That's a really good probiotic brand. Peppermint oil, peppermint tea can help ease pain and bloating, and that has antispasmodic effects. So you really want to make sure that you have an individualized plan with healthcare guidance, and that's really essential and effective for IBS management. Let's talk about IBD treatment options. So managing IBD typically involves a mix of treatments to make sure that symptoms are controlled and preventing flare-ups. So there are rescue treatments like steroids and antibiotics, and that can quickly reduce inflammation during flare-ups. There's maintenance therapy. So your physician might prescribe anti-inflammatory medications like 5-ASA and certain immodulators. This might help prevent flare-ups and minimize steroid use. There's also biologic therapies for severe cases like infliximab, and that targets the immune response to maintain remission, but it does require careful monitoring because of the side effects. And then sometimes surgery is used. When medications aren't effective, surgery is used to remove affected areas, and that might be necessary. Treatment plans are always personalized to balance effectiveness with minimal side effects for a better quality of life. Now, understanding IBD and IBS also means understanding how our gut and brain interact. This connection is known as the gut-brain axis, and it's why many of us feel physical reactions in our stomach during stressful moments. So for instance, have you ever wondered why you get butterflies in your stomach when you're stressed, or feel the urge to run to the bathroom before a big presentation? Now, these responses are great examples of how our digestive system reacts to stress, especially around high stress times like the holidays. So our nervous system has two competing components, the sympathetic and the parasympathetic system. The sympathetic system triggers this fight or flight response. It kicks in when you're facing stressful situations like hosting a holiday dinner or managing family dynamics. Now, this system dilates your pupils, raises your heart rate, increases your blood pressure, and even makes you sweat. On the other hand, parasympathetic system is in charge of helping you digest food, sleep, dream, and relax. Now, our patient Joseph, dreaded the holiday season. While others looked forward to festive gatherings and traditional family meals, he found himself mentally mapping the locations of all the bathrooms in every relative's home and calculating the distance between each stop on his holiday shopping route. Now, living with inflammatory bowel disease, or IBD, really had turned what should be joyful celebrations into anxiety-inducing challenges. Now, he said something to me that really resonated. He said, last holiday season was my breaking point. I had to leave the table 3 times during dinner. Between the rich foods and the stress of hosting family and the guilt of constantly disappearing, I felt like I couldn't enjoy any of it. And that's what I knew. That's when I knew I needed to better understand what was happening in my body and to find new ways to manage it. Well, you know how the holidays just throw everything out of whack? So for patients like Joseph dealing with IBD or even IBS, It's like that, but cranked up to an 11. Think about it. Suddenly, your regular routines are all over the place. You're eating dinner at 9 p.m. instead of 6 p.m. Maybe grabbing quick lunches between shopping trips and your morning gym session. Yeah, it's probably happening when you're up late at a holiday party. Well, here's the thing. Your gut doesn't like chaos. It's like having this super needy roommate who gets upset when you change things up. So for patients like Joseph, it kicks off this whole frustrating cycle. He starts stressing about upcoming holiday events, and his gut immediately goes, "Oh, you're stressed? Well, let me make that worse for you." And then he starts worrying about having bathroom emergencies during these gatherings, which, surprise, makes his symptoms even worse. And then let's talk about the holiday food for a second. Now, we're not just dealing with different food here, we're talking about rich, heavy dishes that might show up once a year. Tons of sweets, right? Tons of desserts everywhere you look, and maybe more alcohol than usual. So, for someone with IBD or IBS, it's like walking through a minefield while trying to be polite about turning down Aunt Linda's famous spicy casserole. Let me break down how stress really messes with your gut, especially when you're dealing with IBS or IBD. It's fascinating, but also pretty frustrating for those experiencing it. Think of your gut and your brain as best friends who are constantly texting each other through what we call the gut-brain axis. When stress hits your brain, it immediately shoots a message to your gut, triggering all sorts of responses. So for someone without digestive issues, this might just mean butterflies in their stomach. But with someone with IBS or IBD, it's like their gut cranks up the volume on every message. So here's what actually happens. Stress hormones like cortisol flood your system. Your gut motility changes. So this means things either move too fast or too slow. Inflammation can increase your gut's protective barrier. So this might become more permeable. Imagine the walls of your gut becoming slightly leakier, and the balance of your gut bacteria can get thrown off. So for someone with IBD or IBS, this creates a perfect storm because their gut is already more sensitive to begin with. Regular everyday stress might cause mild discomfort in others, but for them, it really can trigger some serious symptoms. I'm talking severe cramping, urgent bathroom needs, bloating that makes them look 6 months pregnant, changes in appetite, nausea, and any flare-ups of underlying conditions that they may have. And the really tricky part is that this becomes a vicious cycle. So you get stressed about having the symptoms, which trigger more symptoms, which causes more stress, and round it goes. It's like your body's own version of a feedback loop gone wrong. Now, after consulting with Leafwell, Joseph began exploring the role of the endocannabinoid system in managing his symptoms. The endocannabinoid system is a complex network that helps regulate various bodily function, and that includes digestion, immune response, and stress management. Now, what makes it particularly interesting is the high concentration of cannabinoid receptors that are found throughout the digestive system. Now, cannabinoids can play several important roles in managing this IBD-IBS inflammation and gut health. It can play a part in mucosal protection. So it protects the mucosa. The cannabinoids protect the gut mucosa and help maintain and repair the gut's protective barrier. They can reduce intestinal permeability, so reduce a leaky gut. Now, I'm going to talk about this more in a minute, but it basically supports mucus production that protects the gut lining, helps to restore balance in gut barrier function. So in this inflammation control, what ends up happening is that it's reducing pro-inflammatory cytokines. And this basically helps regulate immune cell activity. It lowers oxidative stress in the gut tissue, And this can calm an overactive immune response. So during flares, you might find that cannabinoids will help reduce urgency, reduce the frequency of bowel movements, help manage that abdominal cramping and pain, improving appetite, reducing nausea, and supporting sleep and reducing stress that can worsen flares. So the endocannabinoid system is involved in all of these processes, which is why cannabis-based medicines can help address these multiple symptoms simultaneously. Now, importantly, these protective effects can work both during active flares as well as preventative support during remission periods. Now, your intestinal lining acts like a brick wall where cells, these bricks basically, are tightly held together by mortar. So when this mortar weakens, gaps allow harmful substances, so think bacteria, food particles, to leak into the bloodstream. And this is what triggers the inflammation and the immune response. So for people with IBD, a weakened gut barrier, it's like having a fence with holes and letting unwanted substances slip through and worsening inflammation. And this cycle can cause IBD flares, joint pain, skin issues, low energy, nutrient malabsorption, and even brain fog. Now, cannabinoids may help repair this mortar, strengthening the barrier, supporting your body's defense, and potentially breaking the inflammation cycle. So let's talk about the science behind the solution. So what is this relationship between cannabis and gut health? It's complex, but it's really promising. So studies have shown that when patients with IBD used medical cannabis to manage their symptoms, their reliance on medications significantly decreased over the course of a year. Cannabinoids like THC and CBD can influence the composition of gut bacteria. So potentially, this is helping maintain the integrity of the gut lining, like I discussed before, reducing inflammation. And then cannabis interacts with the endocannabinoid system in your body to promote the mucosal healing. So you're going to improve symptoms in patients with conditions like ulcerative colitis and Crohn's. And this research also suggests that certain cannabinoids can help protect against these increased gut permeability. So it can actually protect the gut from becoming a leaky gut, which is exacerbated by the stress, perhaps poor diet choices that are really common during the holiday seasons. So here I want to talk about complementary and alternative medicine, because complementary medicine offers a variety of options to help manage inflammatory bowel disease, including ulcerative colitis and Crohn's, also IBS. And these therapies often are used alongside standard treatments. These complementary treatments focus on easing symptoms, improving quality of life, and sometimes even helping to influence the course of the disease or the flare-up. And working with his Leafwell doctor, Joseph developed a comprehensive management plan. And this is what it included. So we put together a medical cannabis protocol for Joseph. We had him start with CBD products, and then we gradually incorporated other cannabinoids, such as THC and CBG. We had regular check-ins with Joseph to monitor his progress. Then we talked about lifestyle modifications, his stress level. We talked about stress management techniques, including meditation, breath work, and modified holiday recipes to be gut-friendly. We created a list of safe foods for the social gatherings. Basically, foods that, could trigger for him things like he can grab that will not create any flare-ups. And this is what he could use during the holiday parties or even between the holiday events for recovery. So we created his go-to list. We created gut health support through probiotics. And probiotics, again, support healthy gut bacteria. We also talked about prebiotics. Now, prebiotics can be used to nourish beneficial microorganisms. Then we talked about anti-inflammatory diet modifications as well. So how do I choose the right cannabis formulation for my digestive condition? This is a question that we get asked all the time. There are different types of products that you can use. You can use enteric-coated, extended release, a powder formulation that you can put on top of food. And what an enteric-coated or an extended release or even the powder formulation, you're basically getting ahead of the symptoms. So you're having cannabinoid in your body for an extended period of time, and you're not waiting for that acute pain to ever come. So you're really a step ahead of your symptoms. You might use a rescue formula, especially if there's a sense of urgency or cramping, or if you might need something immediate. And this could be a fast-acting spray or an inhaled formulation. And you want to be careful of edibles such as gummies and chocolates because they can be irritating to the gut depending on the sugar content and the additives. So you just want to make sure that you're aware of that. A lot of our patients will use dark chocolate edibles because it can be well tolerated because it does have lower sugar content. Cannabis suppositories and topicals are also effective, especially for localized relief. And this can be used overnight, and it can be helpful if you have any fissures that are not healing as well. Now, as the holiday season approaches, IBD and IBS patients face unique challenges with unpredictable schedules. We talked about those dietary changes, increased stress levels. So rather than waiting to manage the acute symptoms during the festivities, a proactive approach is really starting months beforehand, and that can maintain your gut health and prevent the inflammatory flare-ups. So think about this. You establish a strong anti-inflammatory foundation through consistent cannabinoid medicine. So you actually start the cannabis medicine before the holidays kick in. You start stress management before the holidays kick in. Dietary awareness, different lifestyle protocols. I would say beginning in September. So well before, November, December. And that way you can build resilience before the period of the holiday rush. Now, this is a great preventative strategy, which includes careful attention to sleep, so making sure that your circadian rhythm is balanced, stress levels, inflammatory triggers. This basically creates this protective buffer against the inevitable disruption of holiday celebrations. So you want to get ahead of it. Now, the reason why you want to get ahead of it is, just think of this all as creating a wellness savings account. The more you invest in your gut health beforehand, the more flexibility that you'll have to enjoy the seasonal festivities without paying a heavy physical toll afterwards. Now, this approach allows you to strike a balance between enjoying the moment and maintaining overall well-being. So let me share some practical insights for IBD and IBS patients for approaching the holiday season. Pre-holiday preparation. Now, the key here is starting early. The rationale for starting in September is quite sound. It gives the body time to establish a baseline and develop this resilience before the holiday stressors hit. And this proactive approach helps identify which anti-inflammatory protocols work best for your specific symptoms. Now, it's much, much harder to get inflammation under control once it's flaring, especially during the busy holiday schedule. So let's talk about some key anti-inflammatory approaches. Cannabinoids, like I mentioned before, has been shown to help modulate inflammation with that endocannabinoid system. So cannabinoids such as CBD, THC, CBG, CBN, specifically demonstrate anti-inflammatory properties that may help maintain the gut homeostasis. So regular use of cannabinoids can establish a consistent endocannabinoid tone. So you might want to consider working with a healthcare provider to determine the appropriate dosing and the appropriate cannabinoid products. Let's talk about lifestyle protocols. To start early, sleep hygiene, like I mentioned. Establish a consistent sleep schedule. You want to aim for about 7 to 8 hours nightly. So create a relaxing bedtime routine. You want to make sure that you have stress management under control, regular meditation, breath work. You might want to do some gentle exercises, walking, yoga. So you want to identify and plan out any known holiday stressors. So you want to keep a food diary, make sure you identify those triggers, and you want to gradually reduce those inflammatory foods early on. Of course, staying well hydrated. You might want to seek alternative methods like acupuncture and, like I mentioned, yoga and movement exercise. Now, let's talk about our supplement strategy. I mentioned this earlier, probiotics, prebiotics. A company that a lot of my patients use is VSL3. You want to add curcumin, omega-3 supplements are really great for additional anti-inflammatory support. Make sure vitamin D levels are checked. Vitamin D definitely needs attention in the wintertime when you're not outdoors as much. Let me give you some holiday survival tips. You want to have a plan. You want to have a plan for social events. For example, eat a little bit beforehand. Bring those safe dishes. Have a list of your safe foods. Set boundaries around commitments. If you are stretched too thin, it's okay to say no. Maintain regular medication schedule. So don't forget your regular medications that you normally take. And then you want to keep an emergency protocol handy. Plan out for those recovery days after a major event. Try to pace yourself and give yourself that recovery day between those big holiday parties. So you want to remember that consistency with anti-inflammatory protocols builds resilience for later. Now, these small wins, these small daily actions add up to significant protection. And it's a lot easier to prevent the flares rather than treat them. So have backup plans when your schedule gets disrupted. Now, here's a question that we get on a regular basis. Is there scientific evidence supporting cannabis use for inflammatory bowel conditions? Let's take a look at our research dashboard. Let's take a look at our Leafwell research dashboard. So you can see here the Leafwell data overview. So scientists have done about 95 different studies on this topic. Now, of these, 74 studies show that cannabis helped, 14 studies weren't sure either way, and only 8 studies found that it didn't help. So let's dig in and see what these specific studies reveal. Now, looking at specific cannabis compounds, CBD was studied about 24 times, worked well in 20 studies. THC was looked at 15 times, showed positive results in all of them. The other cannabinoid compounds, THCA, CBC, CBG, were studied 6 times, and they all showed good results. Now, I want you to think of your body as an intricate orchestra where every part must work in harmony. So your gut, often called your second brain, is not just for digesting food. It's a key interface with the outside world and communicates closely with your brain, your immune system, and your hormones. And stress can impact your gut, while gut issues can affect your mood and your thinking. And the gut's microbiome, trillions of bacteria, helps with digestion, influences immunity, and can trigger inflammation if unbalanced. Hormones also regulate digestion, stress responses, and gut movement. So all of these symptoms, gut, brain, immune, hormones, muscles, they are just all interconnected. And disruptions in one can create ripple effects across the body. So treating digestive issues requires a whole body approach, considering stress, immune health, diet, and lifestyle. Everything fits into the pieces of the puzzle. And Leafwell's research follows this holistic view. It looks at interconnected systems to understand how therapies like cannabinoids can support overall wellness. So at Leafwell, we recently conducted one of the largest studies of its kind to understand how medical cannabis affects healthcare utilization patterns. So we compared experienced cannabis users with first-time patients. And look what our research found. It found significant reductions in healthcare visits, including emergency room visits, hospital admissions, and primary care appointments, particularly with patients with serious conditions such as cancer, anxiety, and chronic pain. This is exciting because these findings suggest that medical cannabis, when properly supervised, may reduce the frequency of healthcare needs while helping patients manage symptoms effectively. This has important implications for patients that are looking for complementary and alternative ways to manage their health while potentially reducing healthcare costs. This is significant. I want to underline here, 15,000 participants is what we had, and this represents one of the largest studies of its kind. And this demonstrates that with supervised medical cannabis, we can substantially reduce the healthcare load across multiple conditions. So we're looking at, conditions like cancer, anxiety, chronic pain. And these have implications for patient care, healthcare system efficiency, because think about it, you're reducing the need for medical visits while maintaining positive health outcomes. So medical cannabis shows promise as both a therapeutic option and as a potential tool to reduce healthcare costs. So when we apply it to patients with IBD and IBS, these results are especially relevant. These patients often go frequently to doctors, right? Urgent care visits, sometimes hospitalizations due to symptom flare-ups, pain, and inflammation. So given that cannabis can potentially be an anti-inflammatory, pain relief, and anti-anxiety properties, our findings suggest that it can be a valuable tool in helping IBD and IBS patients manage symptoms more independently. And by potentially reducing the frequency of these visits, of these doctor visits, of these ER visits, cannabis could offer patients a better quality of life, empowering them with a therapeutic option that supports their healthcare needs in a more holistic and sustainable way. So I'm going to break down our study for you. So we conducted a comprehensive study. We wanted to understand how medical cannabis affects healthcare utilization patterns. So we looked at two groups. We looked at experienced cannabis patients. So those are patients that have been using it for over a year. And then we looked at new cannabis patients, never used cannabis before, examining their healthcare visits over a 6-month period. So we organized the research, again, around these two patient groups, experienced users, and those are the patients with at least 1 year of medical cannabis use, and then new users, right? First-time cannabis patients joining Leafwell. And then we tracked different key metrics. Primary care physician visits. So we looked at how often do they go to their doctor. We looked at urgent care visits, emergency room visits, hospital admissions. So to make sure that we were scientifically rigorous, we employed this advanced statistical matching method. So we're comparing similar patients based on age, health conditions, and lifestyle factors. So the key findings, our results revealed significant reduction in healthcare utilization among medical cannabis patients. 40% reduction in emergency room visits. 40%. That's huge. 50% reduction in hospital admissions. 48% fewer doctor visits compared to non-cannabis users. Now we know that anxiety can worsen IBD and IBS symptoms by amplifying gut-brain interactions, leading to stress-related inflammation and digestive disruptions. So out of our Leafwell survey of IBD and IBS patients, anxiety is the number one trigger for flare-ups. For patients struggling with anxiety, integrating medical cannabis into their care plan can improve relief. It can reduce their overall need for frequent doctor visits. So at Leafwell, our study showed that anxiety patients who use cannabis saw a 50% reduction in physician visits, which reflects cannabis's potential to address anxiety symptoms more effectively and give patients a greater sense of control over their condition. By managing symptoms like restlessness, insomnia, tension, cannabis can help patients achieve better quality function without the constant need of traditional medical support. So, I do want to note though, our study noted a slight increase in urgent care visits among patients using cannabis edibles. Now, this highlights the importance of proper dosing, proper guidance, because edible forms of cannabis can have stronger and longer lasting effects, and that may surprise new users. So, the take home message is with a supervised integrative approach, patients can benefit from cannabis in ways that are safe and tailored to their needs, allowing them to experience a much more stable, manageable approach to their anxiety care. So while reducing regular visits, to your doctor, promoting safe, effective symptom management, cannabis offers a valuable complement to traditional anxiety treatments. So this is how we help patients at Leafwell. We're working across 37 states to make medical cannabis more accessible to everyone who needs it. We know that every state has different rules and regulations, and we've got you covered. We work within all those guidelines to make sure that you get safe, proven care. Now, what makes us different? Well, we believe in looking at the whole picture of your health, a holistic view. Sure, cannabis is a key part of what we do, but we also talk about how it fits with your other medications, your lifestyle, and even what you eat. It's all about finding what works best for you. And we're pretty excited about the research that we're doing too. We're discovering more and more about how cannabis can help with things like chronic pain, anxiety, and neurological conditions. The more we learn, the more we can help break down old stigmas and show how cannabis really fits into modern medicine. Now, thanks to telehealth, you don't even need to leave your home to connect with us. Whether you're in a rural area or a busy city, we're here to provide quality care that won't break the bank. We really believe everyone deserves access to these treatment options, no matter where they live or what their budget looks like. And at the end of the day, what drives us is pretty simple. We want to give you hope and help you feel better. We're here to work with you to create a treatment plan that's as unique as you are so that you can take charge of your healthcare journey. Thank you for joining me today.